This is your host, Laura Winters, the heart-led pathfinder, intuitive energy healer, speech-language pathologist, and owner of Your Light Holistic Therapy and Wellness, LLC. Welcome to Miracle in Time, a mini-series podcast that brings you the stories of beautiful humans exploring the synchronicities, blessings, and miracles within our perception of time. It illustrates that events are not just happening to us, but for us. Life isn't always rainbows and butterflies, but it is a miracle in time. As a disclaimer, this podcast contains general information about various topics and medical conditions and is for educational purposes and inspiration only. Your Light Holistic Therapy and Wellness, LLC is not responsible or liable for the accuracy of information contained in this podcast. The information contained in this episode is the personal views of the host and guests, respectively. This podcast is not meant to replace the advice of your healthcare provider and is not intended to prescribe, prevent, treat, or diagnose disease. You assume all risks when you continue this episode. Hi, Julie. Thanks so much for being here with me today.
Hi, thanks for having me.
So Julie and I met at the Make the Connection course in Cincinnati in October of 2024. We took this class on myofunctional therapy, and it really changed my life. And I know that it has changed Julie's life as well. So I wanted to have a conversation with her, just how myofunctional therapy and everything has really changed our life.
For sure. Definitely. I agree.
So first off, I want to ask you, how did you get into the field of speech language pathology?
Okay. So I was actually born, I'm deaf in my right ear. I have something called microtia and atresia. And so I never required speech therapy or anything, but I've always just been fascinated, and I have to kind of read lips more and, things like that. So, my parents are both teachers, and they just always thought that they're like, I feel like this is so you and you would love this. And even though I've never worked in a school, I went and observed them at both their schools when I was like middle high school, and then observed someone locally in town who had their own practice. And I'm like, this is it.
That's so funny because my mom was a principal and I always wanted to be a teacher, and she just saw like the change in politics and school and everything. And she had said to me, you don't want to be a teacher. And I was like, well, then what am I going to do? And she was like, the schools need speech language pathologists. Like, you should totally do that. And so it was funny. I think maybe I observed one time and I was like, okay, I just like went into college, declared my major. That's what I'm going to do. And then my first class that I had, it was, it has like the medical piece in it too. And I like immediately realized I'm never going to be in schools ever. But the medical piece is just so interesting. So that's really cool that you kind of had a little similar experience.
Yeah, I love science and diagnostics, but I'm kind of squeamish with blood and things. So I'm not kind of like a hospital chick or nurse or whatnot. But I always loved art too, creative. I'm like been art and sciencey. And my parents were like, unless you're walking around with a pad all the time, sketching or doing like taking pictures, like that's a hobby. So they were right.
Wow, that's really great. So what led you to myofunctional therapy, the course that we took, those kind of things?
Yeah. So it's really kind of funny, which brings into your whole thing too about, I don't know if it's until later into the discussion, but about a higher power intervening. But I've been in pediatric private practice since 2008, after 3 years out of grad school, and worked one-on-one always. And about 6 years ago, I really decided I wanted to open my own practice and be able to kind of focus and hone in on more on like my specialty rather than like a jack of all trades or getting all the things. Not that I can't treat them, but my passion has been in motor speech disorders and severe phonological, R therapy, just more complex cases. And so, I took prompt course, I, did all the things and I've been improving, but the kids who had that open mouth posture was driving me nuts. Like I just didn't understand why they can't keep their tongue up in their mouth. And I was like, I need this to be able to move to the next level. And I was really hesitant to take the course for probably 3 years because of the cost and, the level and wanting to make sure it's the best of what it is. And then someone at the class, Ashley Hackett, has a colleague there who contracts with her, who is the only speech therapist in town that I actually collaborate with and works in on, on motor speech disorders. And she told me about this course that was coming up. And I was like, I think I just have to like bite the bullet and, just do it. And then I also work very closely with an occupational therapist who just had her tongue tie release and worked with Patty. And she said to me, I feel like you'd be really into this. So I was kind of like, okay, like we're doing this. This is in Cincinnati. I'm really, really want to figure this piece. It was just kind of like the last piece to the puzzle that I couldn't figure out on my own. And I've been trying and searching. So I was like, let's do it. And game changer.
Absolutely.
Like I just kind of like dumb luck fell into this by our colleague telling me about it. And then Claire, like I had no inkling about like this was going to be the one. And I mean, we got the queens teaching the course. So
exactly. Yeah, for sure. So we went to the course. It was a great experience. Did you actually have any like feelings of like transformation or like what is some of the things that you experienced personally while you were at the course?
I mean, do you remember me crying?
Yes. I think for you it was like super, I mean, like it seemed like to me you were having these like, just like a light bulb, realization. And I think it seemed like that was for a lot of people who were there. But yeah, I'm just kind of curious, like if you can talk about a couple of those or like.
Yeah. So, I mean, I went into the course not even thinking about myself, more like, how am I going to help my kiddos? And as I'm sitting there and they're talking about these things and they're having us try and do them, like, I can't do this. Like, how did I not know this? How was this never taught to me in school? Like, where it just was so overwhelming how much of it was ringing true to myself. And then that realization of, if I can't do some of these things myself, how am I supposed to teach other people? And I take a lot of pride in what I'm doing. And I was like, oh my goodness, I'm not making some of these sounds correctly. I'm teaching people my compensatory strategies. And I'm going back through my mind. And while I'm also trying to absorb this information. And from the course, I found out that, I don't technically speak properly. I have a tongue tie. I have a small high palate. I have sublingual tori. I don't know how to properly do diaphragmatic breathing. I don't chew and swallow properly. And I'm like, okay. And then finding out that I also have a lot of muscular and skeletal difficulty, triple S scoliosis, sciatica, stenosis, just a lot. Like I do craniosacral therapy massages once a month, go to the chiropractor. I started CFT, craniofacial therapy. I just found this new amazing through that OT person I told you about, a chiropractor who specializes in cranio. And so they all think that they're like, a lot of my muscular stuff can be tied to this tongue tie. So I'm kind of like, if I don't go through with this tongue tie, obviously it's a scary process going through, and are there complications, and I have to take off of work because I can't talk probably for a while. But I feel like, it's not only helping my practice, but it's helping me personally. And I don't want to live in the constant pain that I'm in and whatnot. So I think that we're all like, it's all tied and connected. We're this human system, and I'm so greatly impacted on so many levels. And I just really want to help others. So if I can learn how to do those things too, and also have empathy for what someone is going through, I think that always helps make you a better therapist.
I am so excited to be able to offer a low-cost healing option for moms out there that are overcome by guilt from medical decisions. I am healing the guilt from making medical decisions early on in my children's life that I honestly didn't know any better. As a result, they have chronic illness, and I am often reminded that they have their own journeys too. Love is how we heal our guilt, and we don't have to do it alone. Join us in Healing Medical Mom Guilt. You can register on the website at yourlightllc.com/scheduling.
Absolutely. And I know in my practice, one of the biggest things that I put out there is like, in order to heal others, you have to heal yourself. And so, when I'm talking about this course and trying to get other people involved and looking at things in this new light, because it is I see it as being this bridge between holistic and conventional medicine, where we're really bringing people into, having more awareness holistically about themselves and the whole body. And so our experiences and being able to heal ourselves absolutely trickles out to so many people all around us, our clients, our family, our friends. I mean, further than that we have no idea. So I think this is really great.
Yeah, I just think it's crazy how like pre-course in my world and post-course, like how I think and, just things that you're really noticing. And I was getting angry at myself, like, how did I not know this? And I was like, well, you know what? Like they literally some grad schools might, but I didn't even know I had a tongue tie. Like to me, a tongue tie was someone that only had it all the way up to the tip. And I was taught in school that it doesn't impact the speech and that there's not, related to motor speech. And I saw a lot of my motor speech kids have these really significant tongue ties. So I'm like, there's got to be something there. I just didn't know what I didn't know. And so now that I know, I kind of follow the Maya Angelou, do the best with what you can. And when you know better, do better. I feel like it's just opened up my practice. And how many, I have a couple kids on my caseload who are classic check, 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 check. And I'm just like, the timing of the difference I can make and the referrals I can make out. Like I knew stuff before about the tonsils and adenoids, but no clue about palate and tongue tie, anything whatsoever about that. So it was just mind blowing. And I'm mad at my orthodontist because my whole life people are always like, you have the best smile. And now I'm like, it's horrible. It's narrow. I have these, the black jetways and too much gum showing and all these things. And so we know now. And now my kids who are in the orthodontic phase, I'm questioning the orthodontist. And do you think we need a palate expander and this? Like, it's just given me such empowerment and to be able to help friends to empower who don't know, because there's such a lack of knowledge in the area. I think everywhere, honestly. Yeah. And so, I love what you're doing and trying to get the word out and the importance. And some people are not believers and that's fine for them. I just really like to have all the different tips and tricks and tool bag because no person is alike. And the more information we have, the more we can help serve our population. It's not for everyone, all the things, but I'm finding a lot.
Yeah.
How about you?
Yeah. And, the thing is, I think for the parents' mindset, and even if you're considering it as an adult, I have a friend who, when I came back from the course, she was like so excited. So we did a full eval and she actually went with me to my kid's orthodontist and we drive 2 hours away because I found him as being an airway centered orthodontist. And I did that before the course, but she just got her expander in a month ago. And I'm excited. I'm going to do an episode of even just her voice recordings that she sends me, but immediately her body was like, yes, thank you. Like there were so many things immediately that changed.
This is
for
your
her.
Friend or your friends?
This is my friend. Yeah, this is.
Oh,
yeah.
Okay. Interesting conversation for another time. But I actually went to discuss and was told, don't do. the palate expansion at this age, because it's going to make your teeth like shift out off kilter and a host of problems. But that's a conversation for another day.
Yeah, for sure. And that's, I think it depends on your, obviously your structure and how much movement needs to be made. And if you have the right orthodontist, you know, and what they're seeing. So yeah, she's, how old am I? 30.
So she's doing the traditional one, or
So,
is it like,
so
they told me like mine was too locked and I'd have to do like the surgery to expand.
Oh, really? I don't know, possibly. So she has kind of, it looks like the traditional RPE, but I think they call it an MSC. It has the screws in there. So I don't believe that she's using the screws at this moment, but he put the holes in there. So if she's not getting the expansion, he will screw up into the palate, and then that helps to expand. And for her, I mean, just a little bit, but she had her 6-year molars taken out on the top. So it's really interesting. She has the apparatus secured to the tooth in front and the tooth behind. I mean, it's a pretty massive looking thing. If we look at myofunctional therapy, that's just one piece, but then we might need ENT and airway consideration, and then we might need orthodontic work, and, you know, there at sleep studies. So, and body work. I mean, that's so important. So it can be, I think for me as a parent, is extremely overwhelming. But I think about myself, like, you know, like this morning I was like, oh my gosh, I'm excited, but I'm also scared about this coming weekend. So we're going, and a group of us are, Julie and myself and a couple others, are going to have their tongue tie release. And I'm actually really hoping that he can do the lip and the buckles too. I'm like, just do it all, just get it all done. So we'll see. But I'm so excited because this area right here for me is always on fire. I mean, there is always a level of some kind of heat. It's always there, and it's always been there. And I think about my childhood, like I would wake up in the middle of the night and I'd have to flip my pillow 2 or 3 times because my pillow is completely full of saliva. So like there were things that, like, now looking back, you go, wait a second, this is an issue. But like for me, I wouldn't have even been aware of a tongue tie, you know, like I had no idea, but like, you're like, oh, well, it's right there.
Yeah.
But I can still stick my tongue out pretty good. But then you go, wait a second, the tongue, you know, the more you learn about the body, the tongue is connected to the pelvic floor, and the tongue is actually, the fascia of the tongue is connected all the way down to the toes. So if we're constricted here, of course there's going to be pain. Of course there's going to be tension. Of course there's going to be constriction. So I just I feel so good about it. I feel like
we're in good hands.
Yes, we're in really good hands. It's going to be like, I just, you know, it might not be, but that's what I feel like is going to be like, oh my gosh, just like this, like relaxing, like peaceful, like, thank you, you know?
Yeah. That's what I'm hoping for too. Yeah. I also forgot to mention Swirl Me. I do also have TMJ dysfunction, and I'm a clencher. So, you know, add that to the mix.
Yeah, for sure. And I think that is part, I mean, I always used my retainer because I was always grinding, you know? And so it really, the course in this experience and going through this has been just like so eye-opening in so many different areas of health, and again, for us and everybody around us as well.
Totally agree.
So, okay, thinking about this upcoming Saturday, and then we're going to do a short little episode afterward to talk about the changes after. So I'm really excited for that. I'm really excited, like the before and after. But anyway, so what kind of preparation have you been completing for this tongue tie release?
Wow, good question. I've been doing different stretches on the floor of my mouth, continuing with practicing my suction up, because that's like the hardest thing for me. I really don't have trouble with my range of motion, tip of my tongue, stability, dissociation. I have no issues with any of that. So I can do that, but I don't know. I haven't really been doing that because that's not hard for me. Practiced, like I said, just to see what it's like with like the icing and toothbrush, but I don't know. I'll probably have to talk to Patty to see, but my biggest thing has been really just trying to stretch and loosen. And I also, my craniofacial therapist, I will be seeing her Wednesday. Is that tomorrow? Yes, tomorrow. So she can do one more kind of pre-stretch and get in there. And then I'll be seeing her, I think, the day after. And then like on the Tuesday after, I'll see the chiropractor who specializes in cranio stuff. She wanted to wait 48 hours. So I really feel like for me, it's a lot more of the muscle tension. I've also practiced a lot of tongue to spot. I was using like the blade of my tongue and then pushing my tip down into the bottom of my teeth.
Yeah.
So I spend a lot of time trying to be conscientious of my tongue placement, even though I can't, fully elevate that mid of my tongue. Just really trying to practice that tongue to spot. So pretty much stretches, tongue to spot, and suctioning to try and keep that up. How about you?
Yeah, so I've been doing a couple exercises because my tongue is not very strong, apparently. So I've been doing some like tongue to the roof of mouth, in and out, and then brushing. Okay. And then so I do the craniosacral fascial therapy. So I've been trying to release my own fascia. I actually have an appointment later today with a lady. It's called trauma release exercise. I found it. So I'm working on a technique to teach people how to release their own fascia. So it's something that's similar. So I'm going to see her today, and then I'm meeting with a craniosacral therapist on Thursday. And then I have to ask. So my neighbor just went to CFT training in California. So I told her, I said, when you get back, we can practice, we can trade. So I have to send her a message and say, hey, like, can you see me on Sunday or Monday or something? That's good. I really didn't think about the body work follow-up afterward, but that is super important.
So this occupational therapist actually went to Dr. Notestein. She was, she had a revision from a kid, but she was tied all the way to her tip and has had multiple things. So she's, gone through the process herself, and then just really is super, super talented across the boards. But, the CFT, she's been doing such big work. And then my craniosacral therapist, like I said, and this chiropractor, I'm already seeing such changes. My scoliosis, like my worst part of the curvature, my scapula is becoming more even instead of rotated. And the curve is still definitely present. Well, I have 3 curves, but it's not as pronounced. So I feel like once then this tongue tie happens, like it'll really be interesting to see all those changes. But I'm a believer in all of, I'm not anti-traditional medicine, when needed, but the thing that's been moving the needle has been all of this, like hands down. And I think it's important to have the right people who, don't use just the same approach and have all different tricks and trades and just really look at you as the person. And so like, I feel like I have a really good team around me. And so, yeah, it's empowering.
And the benefits of just like feeling better and, sleeping better and,
I'm excited for that because I sleep well, but I don't wake up feeling rested. It's just a constant in my life. So, I sleep the hours. There's no reason I shouldn't feel refreshed in the morning.
Yeah. Yeah. I am really excited. Have you noticed some of the similar patterns of what you're experiencing in your children as well?
My son, absolutely. In regards to the way he chews, and eats and swallows. kind of, don't use that proper mid cupping and suction. So kind of goes around the back, doesn't chew food enough, and, swallowing safely, but is it really safe?
I know.
With that. And then, I think like that's the biggest thing. They don't seem to have the same level. Like definitely don't have any of the sliding. I don't think so. My daughter is a different story. She has a fused tooth, so she's kind of like, or it's kind of missing tooth. So she's very small in her mouth, but she's very, she's going to overbite and overjet. And so we're just she's in a palate expander right now, but let's get going with that. But so I think she's different in some of her challenges. Like she has to move forward to do, and chewing sometimes it's hard because she doesn't have that same, teeth when I'm home. Mm-hmm. So that, but the most interesting one is actually my husband. So he has very handsome. I know this sounds wrong, but large teeth and a small jaw. So his dad's teeth and his mom's jaw. And they pulled 8 of his teeth when he was younger. And so for years, like every single night, it's like he like almost chokes on his pills. And I'm like, what's the matter with you? Like, I used to always be like, what is wrong? Like, what's the matter? And just like when he swallows, like I can just see it's effortful, and he just doesn't have the space because they did that, So, the effects of that, I see more in him, but what he can do about it, I mean, at this point, I don't really know. Maybe that's in part 2 of the course. I don't know. But yeah, I feel like I definitely observe and I look to see, but my family's like, okay, stop looking at my mouth. Stop, doing this.
Well, what I think is really interesting in some of the work and looking at the things that I have, there's a group who very much says, as if we as parents heal ourselves, that mirrors into our children as well. So it would be interesting to see once you go through the release and, get the work done that you need to, if you see any changes in your children as well, and also, maybe whatever you experience is something that your husband wants to get on board with as well. Maybe he doesn't want you looking in his mouth right now, but if you're like, oh my God, I'm sleeping so good, I feel so good, my body's great, a lot of times that trickles down that like,
Definitely.
Definitely.
No, I agree. And I'm all for too proactively. So, I've mentioned her a million times, the OT, but just having even an assessment to see like, where is your body in terms of needing body work? I mean, I'm sure we all, like, we know if you evaluate someone, you're going to find something, but is it enough like functionally to make an impact? And I feel like I would love, for my kids to do that. My husband, I mean, again, not throwing my wonderful husband under the bus, but he's kind of like, oh, that stuff's a little kooky. But you have to be a believer and you have to be relaxed and, for your body to accept it. And so I don't think you can force it on someone who's, whatnot. So hopefully all this works and he'll be a big believer and try it. But I mean, I know for me, it's the right thing.
Totally. Yeah, no, I totally agree. I'm really, really excited. I'm really.
How about your husband? Is he a believer?
Oh, my sweet husband. He, I think he'll come around. He's coming around. So when I took my son to an orthodontist in town, and in the Toledo area, nobody's doing early expansion. Nobody is looking at the airway. So,
you were driving 2 hours.
So exactly. He's like, why are we driving 2 hours? And then why are we paying thousands of dollars right now when they don't even have their big teeth in for that, and it's a lot. At first it was just like, you just need to trust me. You know what I mean? Like I'm kind of this is like a little bit of a problem, but like if it's something that I want, then I'm going to pursue it. Like it doesn't matter what anybody says. So,
Yep. And you're also like I don't know what he does, but for me, like I'm in the medical, the sciencey, like I get it. So sometimes some people don't know the information, again, just like for us with the pre-course, When it's something that's not your lingo and world, it's like harder to, kind of get on board. But I'm with you. It's like,
Yeah. And even with the tongue tie release, like he's like, so why are you doing this? I'm like, so, like, but and you just have to try to like, for what I do is I try to just leave little breadcrumbs or plant seeds and then just let them grow to whatever they do. And again, coming back to like the more that we just believe in what we're doing and that we're feeling better and that we're conveying that, like you hope that that's a path that they grab onto some of those things and may want to pursue, but it also may not be their thing. So, and that's okay. Mm-hmm.
Okay, totally. He's totally supportive of me doing it, but yes, the same like, what is this? But you do you.
Exactly. And I'm really interested. I don't know that it'll work out, but so the orthodontist that my kids see after we came back from the course, I actually scheduled a consult with a different orthodontist who does like the true elf. And so, but I had seen him before and I said, honestly, I want to be honest. I'm going to tell you that I did this consult because I think this is something that we might need to pursue. And he really advocated for himself. And he said, I can do something very similar if that's what you want. And I said, okay, all right. I believe you. I think that because he said I put it in young kids like 3 and 4, but or I don't know if he said even 5, but the young kids, because they get a lot of movement. But he said I haven't seen enough movement with the older kids. So I said, well, if I get my oldest, and he's hold on, he'll be 10 this year, so he's 9, and so anyway, so I said, all right, I want to do it. So he's gotten a lot of space. We'll be coming up on 16 weeks. At 8 weeks, it was like, wow, and he had been in a rapid palatal expander for almost a year.
Oh, wow.
Yeah. So it was like very much opening wide open. I mean, like wow, he's getting space in the back teeth. Like it's just, it's great. And so I kind of want that we're going to go next week, but be like, hey, like you didn't want to do it in, my son who's a little older. And then it was funny at that appointment that day when we did the follow-up and he was like, wow, we did get a lot of space. When he saw my younger one who's 7, he's 7. He said, I think we might get him in an elf as well. And I was like, wow. So like maybe change his mind just a little bit. But what I want to come in and say, hey, any chance you might be able to give me a little bit of a discount and then try it in me and see how it goes. And then maybe it's an option you can use for other people. Yay. I don't know.
Right. Like I'm your source of, yeah, here you go. I feel like you don't look like you're narrow though.
Well, that's the thing is that the measurements of what they gave us in the class, I'm perfect with the measurements, but my tongue does not fit in my mouth.
So do you have a large tongue?
I mean, it's not abnormally large, but yeah, so it just doesn't fit. So and you can, like when I smile, like I could have more space.
Yeah.
So I don't know. I was like not thinking that at all. And then my friend has had such a positive experience with her expander that I'm kind of like, maybe that will be something that I need to pursue in the future.
Yeah, totally.
Yeah. So I'd encourage you, maybe try to find somebody else and see what somebody else has to say. I don't know.
Yeah, definitely.
It's always worth it to try. We talked about a little bit of like maybe synchronicity or like the two people saying something about the course that kind of like led you to it. But do you feel like there was anything that popped up that was more like, we talked about some light bulb moments, but anything that was like truly like, wow, that was kind of almost a miracle. Like I had no idea that was going to happen.
Totally. 100%. Like I said, I didn't go in with the intention of healing myself. It was, just to really honestly get those open mouth posture kids, not necessarily that had airway obstruction, but not even looking anywhere other than their tonsils, honestly, not under their tongue and at the palate width and whatnot. Unless the kid had like completely like really narrow vaulted, but still I didn't understand, the global impact. So I truly believe that the timing or how it came was totally divine intervention. We're still have a lot of life left to live, and I plan on working for a while. So I feel it was just bigger than my job, for sure.
Exactly.
For
It
sure.
was
I
like,
was waiting for years and holding off, and then how this kind of came about, like I said, I feel so lucky that it almost fell into my lap. Because thinking about now, if I was just still doing the same things and like searching, and not helping these kiddos who have walked through my door, who are now in palate expanders and all the things like that, I just think, I wouldn't be moving the needle in my practice. So it's like, it's the best of both worlds, both me personally and professionally, making a change.
yeah, absolutely. And for your own personal healing, I mean, that's so significant,
Totally. Yes. I'm craving to feel not so tight in my body. And I think it takes, again, there's not like one solution. So I feel like the CFT, the CST, this cranial chiropractor, and then the tongue tie release, they're all contributing in ways. And I believe in holistic, for sure, that we're all connected. It's like a web. And so all the things I can do, I will do.
Absolutely. And it's definitely showing you that when you trust and when you follow that, right? Like there's a lot of reasons to say no to these things, money or time or whatever. But when you really put in that commitment and of putting yourself first and doing the things that you need to in order to feel better, like all of these other things just improve as well.
Yes, totally. I feel like I know you do the CFT also. I like the worst part of my scoliosis sits into like my scapula. So I was constantly before I started seeing these changes, sitting on the corner of a wall, like trying to separate my scapula from my spine to give it a break, to give it like space. So it's not just constantly, I feel my spine all the time. And in the past couple of months, like I feel like there's a little space and I'm not on that wall near as much. Just trying to give myself relief. I'm like, that's not a normal thing to be just sitting on a wall, like the way that I would be, just to feel like I could breathe better,
Yeah.
So,
and who knew that you going to a course to talk about your mouth is now helping your back? Amen. Okay, so we're going to do the last question here, which is, what's your advice for helping other people see the miracles in their own lives?
Yeah, I thought about that. I honestly think it's just being willing to be open-minded and trying something wholeheartedly. You just really don't know, if you have preconceived notions or walls up, like how you could just be walking right by it, right? And like just miss it. And there's the signs there for you. I like to think of myself as realistic on things, but I also am a dreamer, within that, and see, see the good in situations, half glass full. So I'm just kind of why not? Am I going to have regret over doing this? I mean, obviously there's some small chance that something goes really wrong and whatever, but the upside of potential is just so much greater. So I think just like being open to seeing, what's there, like just, if you're just doing what you're doing and nothing's changing, I mean, it's literally the definition of insanity. So just open-mindedness. I've said that like 5 times.
I love it. I love it.
How about you? What do you think?
Oh gosh, you're going to put me on the spot.
Yeah.
I literally see so many miracles just like every single day. So like we normally, I think that like we're kind of taught that miracles are these big things that happen, but there's so many things like when you're shifting onto the highway and someone puts their turn signal to move out of the way, or if you go into a restaurant and you have like you smile at somebody. So like there are these little things we don't realize the impact and the waves that we're creating for other people.
Mm-hmm.
And so, you know, I try to literally see a miracle in everything that I can, because you just, and yeah, I look for it. I mean, I really do. And I try to make a connection to my day or how I'm feeling or what I can do to make a change to help others or myself, or, and you know, there are those what people would say as like synchronicities. And I see those as miracles as well, that you have an interaction with somebody, you know, like when I was at the course, like you have this bright light around you and you were like, oh my God, like there was just like, you could see the struggle, but the realization, and you just are a beautiful person. And who knew that in October we would be together, and then here now in April, you know,
that release party.
Exactly. I mean, who would have guessed?
Never.
Yeah,
yes. And just back to that thing about miracles. Like I think about all the kids in the area and all the places that they can go. And I don't market my business. I'm just word of mouth. But the amount of people who just kind of, not even by the word, just kind of fell into my lap, you know, and needing what I provide, you know, like, how did you end up on my doorstep, literally? And lots of therapists who don't use motor-based speech approaches, like it's not going to work the same way at all, even close, if you're doing traditional methods. And so, or I've had people who have gone for speech therapy for like 3 years. And I had a mom say to me, like, I don't know what to do. I know my kid needs to get better. Honestly, I don't even believe anymore, but like, you're my last, you know, someone said you were good. So here we go, let's try. And she was just like, oh my goodness, you know, and that was like, that means so much to me. You know, I do believe in that. Like some people are brought to me, or like, why am I being skilled in this area? So yeah.
I love it. It's so perfect. And you know, like when you trust the journey, and that's a little struggle that I'm having right now, is like, you know, it's everybody's on social media, everybody's putting all these marketing things out. And when you really trust and you really believe in what you're doing, they are going to be led to you. It's just going to happen. So it doesn't matter how much stuff you put out there, if you put any or if you put a lot, if they're meant to be in your life, if you are meant to cross, they're going to be there no matter what.
Yep. I think we have the coolest job ever. Like, especially, you know, with the motor speech and kids who are not speaking. And I'm finding that some of the motor speech things, I know, tangent, me, squirrel, ATD, you know, I was thinking that it's more motor based, but I'm like, if they're tongue tied, they're not getting to practice that movement around the mouth. So some kids truly, I think, are apraxic, and some it's more was just the restriction. And then once they get that movement, they're able to do it. But either way, it's still that same thing about not making the sound itself so much as like kind of tying it all together to have clear speech and to be there for little kiddos, first words, like true words, and saying mama and I love you. It's like, I feel like that's the biggest blessing, like to be literally present to changing these lives. So go speechies. Woo.
So beautiful. I love it so much. Well, Julie, I am so thankful that you did this with me, and that it's your first podcast, and you did amazing. I swear it was so good.
You had a dog with me the whole time.
How sweet. It's so sweet.
All right. Well, thank you. And I'll see you Saturday.
Yay. It sounds wonderful. All
right. Bye.
Bye.
Thank you for listening to Miracle in Time. If you would like to explore a theme or know someone perfect for this podcast, please fill out a form on yourlightllc.com/podcast. If you would like to learn more about my services, you can visit the website at yourlightllc.com. I want you to remember that with all life's ups and downs, you are divinely held and guided throughout your journey. Don't miss out on this miracle in time.